You know, October is Breast Cancer Awareness Month, so we're talking about women's health on the segment today, and we're talking to Jada Verling-Hill, who's a nurse practitioner with the Coastal Family Health Center, and here on the Gulf Coast. Welcome to the show.
Thank you, Jim.
Well, let's talk about that. I mean, women's health. That's something important to you.
So it is. There's a lot of aspects of women's health. We want to promote things like screening, just as we would in any other type of healthcare, because the screenings, if we can identify things that are problematic at that point, a lot of times we can put a stop to the progression of that before something gets very out of control, and then we need like a lot of diagnostics and referrals and more care than if we could detect something earlier on.
How long have you been in the nursing practice?
So
I won't say business. But
yeah. My background is labor and delivery. I had done that for 6 years, and then I've been a nurse practitioner now since 2015.
Oh, wow. So 5 years you've been doing this.
Yep.
Now, how long have you been with Coastal Family Health?
Since 2016.
Okay.
So 4 years.
4
years and going.
Any reason in particular why you chose that field as far as women's health?
It just called out to me. A lot of labor and delivery nurses that have that type of background go more so into women's health. So it just seemed like the next step from where I was as an RN.
Now, I know October is Breast Cancer Awareness Month. I do a thing here for October called Real Men Wear Pink, and I'm part of that drive and fundraiser. And I have some family in the past that have went through breast cancer, survived it. So it's something that's very important is to get early detection. What are some of the backlying issues that should compel a woman to go and get checked out?
So breast cancer is very prominent. 1 in 8 have it, but because we have gotten so good at detecting breast cancer earlier on, then the treatments seem to be more successful than other types of cancers. So things that, number one, if you have a strong family history, 1 or more first-degree relatives, such as a sister or a mother, that in itself could promote even an earlier screening than the average. So strong family history, if you have any type of symptom, a lump, a discharge, any kind of significant pain, just something new going on that hasn't been there before.
And we all know our bodies. If something doesn't feel right, doesn't. You should get it checked and don't just push it aside.
Right. So generally, screening is recommended. We can start at age 40, and screening means you don't really have anything going on. We're just doing the markers to make sure that we're getting a good baseline. And like you're saying, not that if we do find something later that we know isn't normal for our body, that we can say, hey, this was our baseline at age 40, and now we're 43, and we have this going on. So just getting a good baseline screening is very helpful as far as detecting any abnormalities in the breast.
And as you said, as far as treatment for breast cancer has come so far in the last several years that the mortality rate is higher, being able to survive it than it used to be.
Right. So at Coastal, unfortunately, sometimes we do see patients that have had barriers to getting health care, either financial or just economic, all kinds of things. So we do see patients sometimes enter later without the previous screenings. They may be 10 years past the starting screening age, but we do provide opportunities at Coastal for patients that may not be able to afford the screenings. We have a voucher program. We also have a sliding scale that can help them get in and get their mammogram done. And then there's a program that we work with, the Mississippi Breast and Cervical Cancer Screening Program. We can enroll them into that program if they meet the age and income requirements or get pre-approval if they're underage. Then they can get the program approval to get the screening done that they need to have done to detect anything that may be abnormal going on.
So this is a great way of helping them that don't have the insurance or financial to get in there and get it screened correctly.
So luckily, Coastal has just gotten a new 3D mammogram machine, which we are very excited about, just in time.
I've seen one of those because I've interviewed doctors before that had those. They're really cool.
Yeah, so this takes 15 images of the breast in 3 seconds. And then from the 15 images, if the radiologist detects anything abnormal, they can further delve into the slices of the breast images, and they can decrease the densities and things that may cause artifact that may prevent them from detecting a normal versus abnormal breast tissue. Once these things are detected, we can refer them out for further diagnostics if we need to, if they need a ultrasound or any kind of MRI or breast biopsy imaging.
Now, do y'all do any type of treatments there?
We do not do treatments, but we can help provide the referral to the breast surgeon, which may do the biopsy. They can do a removal at the time of biopsy, or get them referred to a facility outside of Coastal where they can start treatment as needed.
What other type of health issues do you work with women? I mean, this is Women's Health Month, so talk a little bit about that.
So we
Coastal Family
also
Health
do Pap smears, which is a cervical cancer screening, okay? And they've actually spaced out the guidelines for that if they're normal, but it is still recommended to follow up annually. We can do a blood pressure screening, which is you know, we don't think of a blood pressure as a screening, but it is a screening tool for cardiovascular disease. We can do things such as a thyroid or glucose. Also see pregnant patients, so we see anything from normal routine pregnancies to patients with diabetes, hypertension, history of preterm deliveries. So there's a wide variety of patients that we see at Coastal.
Now, you mentioned one thing, cardio and everything. Women usually, they're more susceptible for having heart attacks than men are.
So fortunately at the clinics, we have several primary care providers in most of the clinics as well. So if I detect something that may be abnormal with the blood pressure or something cardiac history with the family, it's very easy to have our patients follow up in the same clinic with a primary care provider who can provide further labs or diagnostics, or even start medication if that's indicated for any cardiovascular abnormalities.
Got about a minute left. Any other issues that you deal with women that you'd like to mention? Sometimes it's just a good shoulder to talk to.
Unfortunately, we're not able to do too much telehealth at this point. A lot of GYN issues, you know, require bringing patients in. We're trying to promote telehealth whenever possible, but we are still, you know, very open to seeing patients appropriately as we can right now for GYN issues in clinic.
All right. Well, we appreciate you being here and the wonderful work that you're doing. Again, if you need some more information, websites on the screen, I guess they could call and make an appointment and find out if they're qualified for your services?
Right. We have another women's health provider in Gulfport, so they can either see me or her, and then we'll get them where they need to go.
All right, that's wonderful. Appreciate it. Thank you, Jada. Appreciate you being here with us today. Again, if you'd like some more information about the wonderful work that they do there, you know, not only for women, but for everyone, men and children as well, you can go to the website. It's on your screen there. Give them a call to set up an appointment and get a screening. Ladies, remember, this is Breast Cancer Awareness Month. Remember, early detection is important, so make your appointment today with Coastal Family Health for your screening.